Hi, welcome everyone. I'm Carla Titus with Welcome Works Within. We are a fractional CFO firm providing financial and consulting advisory services to growing businesses. We're here at the Waste Project Summit conference, and I've met my friend Steve, who is going to introduce himself and tell us what he does.
Yep. So I'm Steve Fydenkevez. I'm with Apple Tree Billing. We are a behavioral health specific biller. We've been doing this just right before COVID is when we got started. Actually started the company with my mom, who's also a practice owner. So she's a practice owner. I was in the insurance world, and we saw billing. The billing landscape was changing, and so we kind of came together to start up Apple Tree.
Great. Such a need of support, because I find that a lot of the practices we work with struggle with the billing and credentialing side of what they do because it is complex. It's always changing and evolving. And I think the reason we wanted to do this conversation today and share with you all about what trends we're seeing in the insurance billing side of the mental health practices and what are some of the issues maybe that you will be encountering as you go through your journey of growing your practice. And we wanted to share some of the inside trends that Steve is seeing on his side, and then how that applies to the financial side of your business and what you might be able to do, what pieces of that you can control and what pieces of it you just kind of have to deal with. So tell me, what are like some of the top trends that you're seeing currently in the industry?
Yeah, certainly. So the biggest thing is that all the trends seem to be coming from the same place. And the source of these trends is that volume since COVID has just exploded.
Which is fantastic,
Which is
right?
great.
Like it's good. People are accessing mental health,
That's right? That's right. Yeah, they're accessing it. Telehealth has made it more accessible. Seems to be less of a stigma around having mental health right now. There's a lot of young people and parents of their kids, right? It's like every kid now, they have like their tutor and their counselor, right? And their therapist. And so there's a lot of good that has come from that. And I think one of the things that, we have sort of in a phase where since COVID, the last 3 or 4 years, we've got to enjoy this increase of volume. And I think the thing that is catching a lot of folks by surprise is now the sort of insurance companies' response to that increase of volume. And the biggest thing is with these trends, insurance companies are huge. And so it's like inertia. It just takes them a while to get going, right? So it takes a little while for the claims to hit, the increased payments to hit, and then they are going to come up with their response. But sometimes you don't feel the response until your contract is up for renegotiation or something. So it feels like it's been a couple of years. Why is this happening? Some of these changes happening now, but that's just kind of the length of time it takes sometimes for these insurance companies to respond to the trends that they're seeing.
Yeah, you mentioned like it takes some time because they're a big company, right? Big companies take longer to respond.
That's right.
But they've also been gathering data and analyzing trends for the last 2-3 years.
That's right.
And now they're finally coming to a point where they can't take action. So if you're seeing changes happening now and you're like, why now? It's because it's taken them that long to gather the insights to then make decision-driven, changes for the company.
That's right. Yeah. And because, for a long time, behavioral health wasn't as commonly used. And so we were hardly on their radar.
Right.
So we didn't really need any sort of special treatment. Now that there's a lot more sessions, we're actually seeing some special treatment. And it's not so special because it makes things more expensive. Because really they're changing the policy structure. And that's actually the biggest change we're seeing is that it used to be that if you had a medical plan, behavioral health was almost like an afterthought. It was in all the same buckets. It was barely being used. And so your counseling, your sessions were just part of your general deductible, right? They were just part of your normal copay. And what's happening now is it's actually getting carved out because these insurance companies are getting kind of sick and tired of your weekly sessions eating up your deductible. So when you do have go to the emergency room, you break, something else happens, those things are now fully covered because your deductible is gone because you had weekly sessions.
Which is great for patients that are accessing care and getting the deductibles and that faster. But it's not great for insurance companies that are focused on making money.
That's right.
And at the end of the day, they are a business, as we know. So they're going to try to change things in their favor.
That's right.
So I think that was like one of the trends that you were going to share with us on like what they decided to do and how that's impacting practices now.
That's right. That's right. Yeah. So we've seen really 2 different strategies. And one is they're actually carving out and putting an entirely separate behavioral health deductible. So the overall deductible might be lower. They maybe used to have a $5,000 deductible, but now they have a $2,500 deductible and a $2,500 behavioral health deductible. And so what that's essentially doing is they're not able to eat up all of those coverages for the rest of their services just through behavioral health. So they're getting behavioral health specific sort of carve out. And then the other thing they're doing actually, and this is probably more common, is they're wiping out the deductible application entirely for behavioral health. And if you're looking at coverage reports, it's not always under behavioral health. Sometimes it's under professional services or specialist services. Those are typically what a practice can fall under. There's no deductible at all, but you're seeing much higher copays. You're seeing $95, $110, $75 copays. And those copays, now, you're not even chipping away at a deductible long term. You're going to have that $95 cost throughout the entire year.
And this is passed on to the private pay side of your practice. So even if your insurance pays, now you're asking your patients, your clients to pay 3, 4, 5 sessions at $95 a session, where before it wasn't the case. So you might see a little pushback also from clients being like, why is this so expensive? How did it become so expensive? When did that change happen? It has nothing to do with your practices. Practice is the insurance policies changing. So communicating that clearly, setting up direct expectation with your private pay side of the house, and making sure you're also actively collecting is going to be important for your cash flow in the business, because that might change the picture before they even hit a point where insurance is covering higher rates.
That's right. And we're very used to, in the industry, there's the January and February deductible dip. And then there's this great spike sort of after summer vacation, getting into the holiday season. You're about to see all those relatives, time for extra therapy. Your deductible's been met, therapy's free, right? But now we're not seeing that. So there might be more sessions in January, February, but now people are still going to have their copays, that $95 copay, into November, into December, if they had a January and December policy. And so I think, practice might need to be ready for, maybe you're not going to get that same spike. You're not going to get that influx of session count in November and December, because it's not going to be free for your clients.
Quote unquote free, because it was never free, but
it was never free, but it was fully covered.
People felt like it was free,
therapy.
And therefore they were more willing to access. So now they have to pay all the way through April, or June. Before it's covered at 100%, they might hesitate to continue to get care, which is, affecting treatment plans and like the supportability. But it's a reality that it's coming out of their wallet. So they're going to
And so now, really, kind of the best advice that you can give to your clients, it's not immediate, because it's not like they can go immediately change it, but make sure if they value your relationship and want to continue to see you, whether it's themselves or it's their spouse, whoever is picking the plan, it's very important when they pick the plan. They don't just pick the plan at the lowest price so they get the least impact on their weekly paycheck. They need to look at the specific coverages they're getting, and it is that bucket under the professional services, that copay, because they still are going to be able to get a choice, obviously, depending on what their employer offers. Can they choose as low as a $25 or $50 copay, and not just so they get the most in their weekly paycheck or biweekly paycheck? Don't choose the plan that's going to come with a $100 copay.
Right. Choose the plan that covers the services that you're looking for, that gets you to save money on using the services, not just on the monthly premium you pay. And then you were talking to me a little bit about this location, aspect of what insurances are going to be changing soon, or have already implemented. Maybe you're not seeing the impacts yet as a practice owner, but you will soon start to see that.
This has been the longest one that the insurance companies have been collecting data on, in that the use of telehealth really has changed. That's been the biggest driver in the increase in session count. Is that people can now just access it much, much easier. They don't have to leave their couch. They don't have to drive through town and park somewhere where their vehicle may be seen going to get therapy, right? They can do it from their own home. And so what that means, though, the insurance companies are seeing that volume. They're trying to measure it. So there's been this emergence of this location 10, which is different than location 02, right? So 02 is what they used to put in for if they weren't in the office, which is 11, 02, telehealth. Now they want you to use 10 if the client is sitting at home. And how they're using that now is they're trying to see what percentage of claims does your practice have that's location 10. Because that means you're building an entirely telehealth practice if you're at 75, 80. Some practices are 100% location 10. And so what they're starting to do, and we've started to see with Medicaid, and you know that it's coming with commercial payers, is there's actually going to be a rate reduction for the use of location 10. There's been a lot of stuff out there that's saying you can't be changing your 90837 rates, or you can't be reducing them to sort of penalize that as a civil right for access to healthcare. So they found the loophole. We won't mess with the CPT code. We'll mess with the location that they're using, right? And so we've already seen it. I've worked with some practices in using Aetna in New Jersey, and they're offering, you look at they're sending you a new thing to sign. Updated fee schedule. Great. 90837 is up 10%. Beautiful.
We all cheer.
We all cheer. This is great. More money. Further down the line, location 10 is a reduction of 25%. So you're getting more for the 90837, so it's helping practices that are in person.
Correct.
But you're getting a huge reduction. So it's actually a net loss of 15% if you're entirely telehealth. And so for hybrid practices, you're sort of 50-50, and half your sessions are 10% up, half your practices are 15% down. And their logic is, you're entirely telehealth. You don't have the rent, you don't have the other overhead. And so they can justify because insurance is highly regulated. So the insurance commission checks, why are you paying a certain amount? It logically can make sense, and they can support it as reasonable that telehealth-only practices don't have certain costs. Yeah. Those costs normally reflect a certain percentage of the budget. Therefore, we can reduce the rate by what that percentage of the budget will normally be.
And with you and I know working with practices, the reality is you don't get to reduce your clinician's pay just because this happens, right? Sure. Also, what is in your control to change? And this is where we always go to when we're talking to our clients as a CFOs. We say, what's in our control? We can't control what the insurance does, but we can control where we service our clients. Right. If we decide to go 100% in person and use our lease space to fill it up to capacity and say we're going to reduce the amount of telehealth because we know we just got a pay cut there. And it's unfortunate that we have to do this, but in order to survive and thrive and create profit for the practice, we need to be conscious of what changes are happening and how we want to respond to that. The other option is if you are 100% telehealth and virtual, you can look at your P&L and look at where can I reduce some other overhead costs that maybe are not necessary, that maybe I can make do without. And then every new hire commission you bring into the practice, you might need to reassess your compensation structure because you need to afford this 25% drop now going forward because insurance thought, you don't have rent, so I'm going to take that money away from you anyways. And also, we do not encourage you to build anything different than what it truly is. So you want to stay legal, compliant, build a code that it is. Now we got to figure out how to have a financial plan in place to mitigate that reduction in.
Yeah, and that's always and it's so hard because it's like biting the hand that feeds you. It's sort of playing like the insurance should not be dictating how you provide the best.
You got it.
And yet it's so tempting because follow them, right? The money is what allows you to continue to help more people. But yeah, you still always, no matter what it is, right? Don't just start going back to 02 just because 10, you always need to go to the most specific and accurate code whenever you're providing services or when you're talking about modifiers. So there are certainly things that you can do. This is always one of the big dangers of doing insurance is that you can get away with something. You can get away with pretty much anything for a certain amount of time
until you get audited, and then it's like, oh no,
it doesn't make it right. It doesn't make it legal or ethical just because. And that's the thing; they're never going to find anything out immediately, but they will almost always find out everything eventually.
Yeah.
And so just because I switched back from 10 to 02, I'm getting more money. I've gone through 6 or 8 or 10 billing cycles. Yeah. This is great. My practice is back on track. That is not sustainable, and you don't realize that you actually have a big liability hiding within your cash, right? That they can someday come to recover. And what makes it worse is as soon as it becomes intentional, that is actually when you cross the line into insurance fraud, because insurance fraud is actually the intentional act of manipulating,
of knowingly
doing something to get more money than you should.
Yeah, and it's not worth it. The headaches. I mean, we do not want to bring in an audit and have them go through everything. They're not only going to go through this code, by the way. They're going to now open up to everything because they're like, well, if you did this here, what else have you done that we can catch and get our money back from. So it's just not worth the hassle. I think what best course of action is to create a new financial plan that accounts for this drop, decide what you want to do about it. If you need to reduce the number of clinicians, if you need to grow differently, if you have to have a different compensation structure, those are things that are in your control. Again, we talk about the financial side. What are you in control of and what do you want to do differently going forward because of this new information? So having also the cash runway to react to these changes is really important. So if you haven't already, building that cash reserve so that when these things happen and you start to see your billing drop, you're able to take time to assess, decide what you want to change, and then implement that change before you run out of money to pay payroll or do anything because, they're coming.
That's right. Yeah, that's right. Yeah, absolutely. Yeah, this definitely is something this is not going to be the end of it.
No, sorry.
It's the start, but just like in a lot of things, this is what the insurance company is going to do, and then the industry is going to have an opportunity to respond.
Correct.
You know, and so I wouldn't be, so this seems to be sort of the next move that's happening. But then there's certainly going to be the time when you have the opportunity then to react and negotiate your contracts back. So especially as you're getting emails from it's so common. You get the email from the insurance company. It doesn't require signature or action. So you move it into the spam bucket, right? You don't read it. Read these things through, because there's indicators down usually at the bottom. It's not on sort of the first screen. You got to scroll to find it. Keep an eye out for sort of if these changes are coming, what this trend is going to be looking like. And then if they do send you something to re-sign around your fee schedule, read the whole thing through, contact your attorney, whoever you're using to look at your contracts and sort of get your business set up. Now is not the time to be skipping. Yeah, now's not the time to be sort of skipping on the fine print.
Right.
Because insurance companies now finally they've collected that data and they're responding. And it's going to be, the practices do have a lot of influence on how the payers act if they're paying attention and if they're communicating with one another. And I would not be surprised if there's going to be some trend coming back where it's, yes, we're doing it this way, but we are only 10% telehealth. So maybe you guys don't have that.
You can negotiate.
That's exactly right. Just because they throw something at you doesn't mean you have to blindly agree to it.
Exactly. And I think it's having those conversations, asking for the rate increase, providing the data that shows that, hey, we're 90% in person, therefore we should not get a rate cut just for that, portion of it.
That's right.
It's going to be that negotiating power that you might be able to have.
That's right.
Especially if you have a big volume of claims, so you might have another state.
And so my background where I started in a call center at an insurance company. And so it's like, okay, so they're doing this to reduce their costs.
Obviously.
Right?
Yeah.
So how do their costs go up? If their call centers get bombarded with calls from angry clients, they have to staff more.
What is therapist call?
Then you can have your therapist talk to their clients and say, hey, look, you guys all whoever the payer is, we are actually going to have to no longer take this payer. Right, because of this issue. So then, now when that client, they have a great relationship with you, they lost their relationship with you because of the behavior of their payer, but they know you take other payers. So when they get to choose another plan through their employer, they move. So you can make it expensive for them, right? To do this by having their clients call angrily because they're losing you. So there are things you can do, right? But it does take action from practices to sort of pay attention, not just blindly sign. Right. And be aware that, you're not just a pawn in this partnership. They need you to be profitable because they need members to choose them when they are having a choice in their insurance plans.
Exactly. And I think having the data and starting to look at this very detailed, updates and rates is going to be an important aspect. Now you've been told, what to look for, where to look for it, and make sure that you're taking the right action according to that. And so, Steve, can you tell people where they can find you if they want to connect with you for more information?
Yeah, certainly. Yes. So appletreebilling.com is our website. You can shoot me an email. It's just steve@appletreebilling.com. We love working with practices of all sizes. We do certainly have a service where we can sort of take over all billing, but we also have some services where we more just sort of support an existing billing structure. So it's not us or another contracted biller, an internal billing system. Sometimes we actually just come in, do some reporting to just show sort of the efficacy of their current billing structure. So yeah, we do have, so appletreebilling.com, we love having conversations about this. We're always sort of learning more, getting new perspective from what folks are experiencing with their own individual insurance relationships, and then using that to help practices just sort of manage their business better. Because understanding these insurance contracts in a lot of ways is just like the lifeblood of their cash flow.
Absolutely.
Are you maximizing the ins and outs of your insurance contracts? Are you using your modifiers the right way? Are you using your add-on codes the right way? Does it allow for supervision? There's so many things within your insurance contract that you might be able to leverage that you're not, that can help grow your business and combat some of these reductions in other areas.
Yeah, and it's important that you have the information so you can take action, you can review things, and make sure that you're informed of what's happening.
That's right.
And those trends will continue to change. So staying up to date, work with someone like Steve that is up to date in the industry and knows what's going on. It's going to help your practice thrive and also drive it towards profitability because we are able to respond timely. If you're also struggling with some of these changes financially and you want to understand, what can we do to support you? We provide services, fractional CFO, a one-time project support as well. And you can find us at wealthworthwithin.com. Make sure to book a call if you're ready to hire a CFO or want to talk about your support needs. Or if not, follow us on our newsletter, on our website, or on social media for more educational content like this. Thank you, Steve, for having us today. I appreciate all the information you shared with our audience.
Great speaking with you. Really appreciate it as well.
Thank you.
All right.